you need to recognize that something is wrong. So brain knows. And the second, such a response for instance, cooling, it will affect local blood vessels. If they're colder, there will be vasoconstrictions, warmer vasodilation, even without neural impulse. So this is how it works. So probably brain knows everything. However, the point is how this knowledge is used. Because it's, in case of neuropathies, probably the interpretation is wrong. This is
okay, I have a question. And what about the possible mechanism and possible clinical ways to use the piezo receptors? Because there are no clinical trials right now, but speaking theoretically, how can we use this knowledge?
I haven't checked that. However, it's you know, the discovery of the role of either piezo or TRP or TREC receptors in, for instance, cardiovascular regulation, cancerogenesis, stability of red blood cells. It's a few years, 2, 3, 4. It's still time for experimental studies. I don't know how it's going on. The majority of those studies is conducted in the USA, probably more than 80%, because they are horribly expensive. By the way, what I got to know about both these two Nobel Prize laureates, Julius and Pataputian, it was not their first huge prize. They got, in terms of money, much higher rewards. You can check it in Wikipedia, like $3 million each of them. This is some kind. Nobel Prize is some kind of traditional prize, but there are some awards, especially in California, with there's a staff from like a best 5 or 7 universities all over the world, and the reward is much higher, like $3 million. So this is a different, and there's something more. This Nobel Prize, the criteria was what they did like 10 years ago. As a Nobel Committee is quite early, by the way. But also the Nobel Council found that it's applicable now. But they got also some rewards from the other committees, in which you can see they are really on time. One of such rewards was recently the recent study was simply about the intracellular pathway of COVID and the application of that to immunotherapy. So they are really on time. And they got this reward. So what does it mean for me? It means that they simply opened some gate, and they still are on this field. They've been still working.
Actually, I may have one. As far as I know, there like curing chronic pain for nowadays medicine is quite challenging. And do you think this discovery will change somehow the way that we had been treating the pain for like past decades?
I think it will. For now, it's not a breakthrough, but there is another option in patients with painful neuropathies, and it may be useful in patients in whom general therapies are not good. For example, they have many contraindications, or the general drugs are not well tolerated. So in this patient, we may use topical agents. For example, capsaicin. So in them.
Yeah. So,
yes.
Do you think it will find a place in some other wards rather than just neurology? I mean, like oncological patients are suffering like a lot of pain, or intensive care patients
yes,
as
course,
well. Like
because capsaicin or zocapsaicin is also used, for example, is in osteoarthritis.
Yeah.
So it may be useful in different
okay.
areas than neurology, of course.
Okay. Yeah, thank you.
I have just a follow-up question. If those to the neuropathic pain, are those channels only in the nerve endings, or are there also in the fibers?
They're along of fibers, and what is pretty important, that they are in, for instance, ganglia. They are also represented in astrocytes. So this is some kind of they play some integration role. What? We don't know. However, I think that in such diseases like acute migraine, diabetic pain, maybe we will see something. The first compounds have been already patented. Okay, we will see what will happen. What is also intriguing, there's some kind of huge increase in publications from China. It's interesting because they use lot of flowers, lot of compounds, including capsaicin, and probably such studies could not be performed anywhere else, but they have some tradition of so-called this natural pharmacotherapy, and now they've tried to test how it's going on, using some kind of research field for focus on mechanisms. So we will see.
We actually already passed the time that we planned at first, but if anyone has some maybe final question. I have one more question, but I don't know if I will be asking too much. But what about this TRPM8 channel, and can they have like any clinical usability, let's say, like can be used in clinics at all, or is simply this pain of cold not a problem in patients?
What do you exactly mean?
That, let's say, those we know that TRPV channels are probably used, like somehow connected to those neuropathic pain, and piezo channels to everything, and those TRPM8 channels, we know they can sense pain, but aren't they problematic at all, like clinically, that we don't try to block them? Or
I see that we are in new times. That means we can perform really horribly huge, tremendously huge proteomic, genomic, metabolomic studies. And the way how the studies are designed is completely different from what I was taught. First, they try to find whatever, make correlations, some, and then to test something that seems to fit, but not the model, the disease, something. This is, and then after that, this is a time for like a basic study. But by the way, it could be effective. I could see how it works in Poznan, Professor Kulpisz, how it works in Krakow, Professor Guzik. This is excellent work. So we can, for instance, find out the new factors of atherosclerosis using completely different way of thinking. That way of thinking is like that we know nothing. We have a lot of cards. We put them up, and then we will find what's going on. This is different. It's expensive. However,